This is a pelvic ultrasound of a 43 years old female with a history of menorrhagia, and this is the uterus in longitudinal section. And you can see that there is, when I align the uterus with the vagina, let's see the condition of the this is the urinary bladder, this is the cervix, and this is the interior myometrium, posterior myometrium. Let's see where is the endometrial canal. This is the longitudinal section, and we see a worldly appearance. Worldly appearance, solid mass within the endometrial canal, measuring approximately 5.7 into 4.7 centimeters. This is the anterior myometrium in longitudinal section. This is the fundus of the uterus. This is the posterior wall of the uterus, or the posterior myometrium. This is the cervix. This is the urinary bladder. And this is the study in longitudinal section, whereby in transverse section. Now this is the transverse section, and you see that when I move the probe posteriorly, we get the urinary bladder, and when I move the probe superiorly, we get the uterus, and then it disappears when I move the probe superiorly. I'll try to get the center. This is the center of the uterus in transverse section. You see that the uterus measures 9.8 centimeters or 9.7 centimeters in this dimension, and is again, we can see that there is a worldly appearance or a complex cystic and solid mass occupying the endometrial canal. Endometrial canal is not visualized, and see that the outer surface of the liver of the uterus is smooth, and the myometrium thickness is preserved, approximately 12.5 centimeters, and then it's even in thickness. Echogenicity is a fine, and the myometrium echogenicity is preserved, and there is no focal lesion seen relating to the myometrium where I am moving the cursor. This is the myometrium, and we do not see any lesion relating to it. Now this worldly appearance or mixed echo solid mass, because you see we don't see any posterior wall acoustic enhancement from this mass, and there are no calcifications seen within it, and this is consistent with either internal adenomyosis until unless proven otherwise by sonographic by 3.5 centimeter probe used, and transabdominal approach. I cannot enlarge more than this, what I'm showing you. Now this maneuvering is just to show you the true shape of this worldly appearance, solid, echogenic, mixed echo rather, mass occupying the endometrial canal. Okay. This is the ovary, the left ovary,